Welcome to the HSSC ATC online training series, where we equip healthcare professionals with essential clinical skills to provide high-quality patient care. In this session, we will cover adult cardiopulmonary resuscitation, CPR, including its purpose, indications, required equipment, procedural steps, and error prevention strategies. Understanding CPR. Cardiopulmonary resuscitation, CPR, is a life-saving emergency procedure involving chest compressions and rescue breaths. It helps maintain oxygen flow to the brain and vital organs until medical assistance arrives or spontaneous circulation resumes. Objective of adult CPR: to sustain oxygen-rich blood circulation to the brain and vital organs, to increase the likelihood of survival in cases of cardiac or respiratory arrest. Common causes of cardiac arrest requiring CPR: 1. Cardiac conditions, coronary artery disease, congenital heart disease, coronary embolism. 2. Pulmonary issues, pulmonary embolism, pulmonary edema. 3. Metabolic disorders, hypoglycemia, electrolyte imbalances, fluid depletion. 4. Toxicological factors, poisoning, drug overdose. 5. Neurological conditions, severe burns, massive cerebrovascular accidents, strokes. Essential equipment: mouthpiece for barrier protection during rescue breaths, automated external defibrillator, AED, with adult pads, bag valve mask, BVM, for assisted ventilation, pocket mask, alternative for rescue breaths. Adult CPR, step-by-step guide. Single rescuer CPR. 1. Scene safety. Ensure the environment is safe before approaching the patient. 2. Assess responsiveness. Tap the victim and ask loudly, "Are you okay?" 3. Activate emergency. Response: call for help, dial emergency services, and retrieve an AED. 4. Check for breathing and pulse simultaneously. First, locate the carotid pulse by placing 2 fingers in the groove between the trachea and neck muscles. Second, look for signs of normal breathing, chest movement, air exchange. Third, perform assessment for at least 5 seconds but no longer than 10 seconds. Response-based actions. Scenario 1. Normal breathing and pulse. Activate emergency services and monitor the patient until help arrives. Scenario 2. Pulse. Present but no normal breathing. Initiate rescue breathing. 1 breath every 5 to 6 seconds, about 10 to 12 breaths per minute. Rescue breathing technique. Position a pocket mask over the victim's nose and mouth. Perform a head tilt chin lift to open the airway. Secure the mask using both hands to ensure a tight seal. Deliver each breath over 1 second, ensuring visible chest rise. Reassess pulse every 2 minutes. If no pulse is found, begin chest compressions. If no mask is available, give direct mouth-to-mouth breaths. Steps of providing direct mouth-to-mouth ventilation: open the airway using the head tilt chin lift technique. Pinch the victim's nose closed using your thumb and index finger. Create a complete seal over the victim's mouth with your mouth. Deliver each breath over 1 second, ensuring visible chest rise. Reassess pulse every 2 minutes. If no pulse is found, begin chest compressions. Chest compressions and AED use: if no breathing and no pulse. 1. Begin CPR, 30:2 cycle. Place the heel of one hand on the lower half of the sternum. Position the second hand on top, interlocking fingers. Keep arms straight, shoulders aligned over hands. Perform 30 compressions at a rate of 120 per minute. Compress at least 5 centimeters, 2 inches deep. Allow full chest recoil after each compression. 2. Deliver 2 rescue breaths. 3. Continue. 30:2 compression to breathing cycle. Automated external defibrillator, AED, application. Place 1 AED pad on the upper right chest, sternum, and the other on the left side. apex of the heart. The AED will analyze the cardiac rhythm and determine whether a shock is required. Shockable rhythm. Administer one shock as per AED instructions. Resume CPR immediately for 2 minutes before reanalyzing. Non-shockable rhythm. Resume CPR immediately and continue for 2 minutes. Repeat cycles until advanced medical personnel take over or the patient shows signs of life. 2 rescuer CPR. Rescuers alternate roles to minimize fatigue. The first rescuer performs compressions, while the second delivers rescue breaths. Role switching occurs every 5 cycles, approximately 2 minutes. Common errors to avoid. Avoid overventilation. Do not hyperventilate the patient. Proper hand placement. Incorrect placement reduces effectiveness. CPR interruption during AED. Analysis. Chest compressions should be paused only when AED is analyzing. AED. Pads on a wet chest. Ensure the chest is dry before applying AED pads. Avoid AED. Use over-implanted devices. If the patient has a pacemaker or defibrillator, place pads at least 1 inch away. Remove transdermal medication patches before AED application. Key takeaways. Compression rate. Maintain 100-120 per minute. Compression depth. At least 5 cm, 2 inches. Minimal interruptions. Ensure continuous compressions with minimal breaks. Effective rescue breaths. Deliver each breath in 1 second, ensuring chest rise. AED. Use. Follow voice prompts precisely for shock delivery and rhythm assessment. Mastering adult CPR is crucial for improving survival rates in cardiac emergencies. Regular practice, adherence to updated guidelines, and confidence in performing these steps can make a life-saving difference. For more instructional videos and healthcare training, visit our website at do.healthcaressc.in. Thank you.